In this lecture, we're going to begin with the new unit here, observational research. And observational research, as the term suggests, it describes essentially the viewing and recording of a predetermined set of behaviors. And when I say predetermined, the researchers have decided ahead of time what particular behaviors they wish to observe and document. Now, systematic observational research just generally refers to those studies which make those observations without necessarily applying interventions. And intervention would be a drug treatment, a therapeutic treatment. Systematic observational research typically does not involve those types of designs. Whether it's systematic observational research or experimental research, external validity is a consideration that is important to both types. And when we think about external validity, we ask how valid are the study findings outside or external to the study. In other words, to what extent can we take the findings of the study, our observations, and generalize those to other situations, persons, places, at other times outside of the data collection setting. Ecological validity essentially refers to the environment. So when you see the term ecological, think about the environment. And in this case, there are two environments in which we think about with respect to this type of validity. The first environment is the actual research setting, the research situation that attempts to recreate the psychological experience. The second environment is the external environment outside of the research study, so quote unquote real life. And an example where this might be a consideration is examining a new educational technique on learning and examining that in a laboratory setting or a classroom setting. So the way the research is designed and executed will certainly have an effect on the extent to which we can generalize to the situation or the environment outside of the study. When collecting such data, a coding system becomes critical to not just the collection of the information, but the planning of the experiment ahead of time. And so coming up with a system on how the researcher is going to collect, document, and classify the behaviors under observation. Some observations are subject to what's called duration recording, in which the researcher is concerned about how long a particular behavior occurs. What we see here in this picture on the bottom of the slide is a research environment where in one part of this environment, we have a simulated room that illustrates some sort of real life situation and where the participants cannot see through the glass, but the researchers can make recordings and observe the behaviors and record the behaviors for subsequent analysis. Frequency count recording, as the term suggests, is focused on recording each time a target behavior occurs, in the sense frequency count. So counting the number of behaviors that was predetermined by the researchers and the timing of those behaviors. Frequency count recording does carry the concern with respect to its usefulness and is limited to short-lived targeted behaviors of the research participants. The duration of the actual behavior tends not to be a research focus of frequency count recording. However, researchers can incorporate both duration recording and frequency count recording within their observations as well. Observation schedule, as the term might suggest here, refers to some form of documentation of the behaviors under observation. And it's critical that the researchers decide ahead of time how those observations are going to be documented. And although unanticipated behaviors can occur, it's often helpful once the schedule of how those observations are going to be documented, and researchers can anticipate possible outcomes that may occur during the experiment. A couple of other terms here in terms of observational research includes inter-observer reliability. And when we see the term reliability, we think about consistency. To what extent can we count on the recordings being repeatable over time? And if we're examining inter for between observer reliability, this is the type of consistency, or often referred to as agreement, between two, sometimes more observers coding the same observation or phenomena. And this is also known as inter-rater reliability. So these two terms, inter-observer, inter-relator, are used interchangeably. And so when you think about inter, think about between multiple observers. It could be as few as two, or it could be more. So, for example, we might have two different therapists examining the same patient, and do both therapists walk away with the same assessment or diagnosis of that patient? If the methods to diagnose the patient are consistent, then we could say that the therapists have a high level of inter-rater reliability. Intra, which means within observer reliability, refers to a single observer. A single observer or therapist assessing a patient or a research participant more than once. So evaluating one patient or client two or more times in a clinical setting. In a research setting, this would be bringing in the same research participants into the laboratory setting more than once. It could be as few as two, could be many more. And so the methods to make the observations should be applied in a consistent manner, with the overall goal of reliability is what's called acceptable agreement. It's important to note at this point that when we think about and talk about reliability from a research perspective, uh, it's extremely rare for reliability to be perfectly consistent or 100%. But depending upon the questionnaire, depending upon the research method, reliability can be quantified with a numerical value. And so usually the line of research in that field will establish what is considered the numerical value for acceptable reliability. And to improve reliability from a research perspective, it's often recommended that researchers engage what's called pilot testing, not necessarily a pilot study, but pilot testing. And so pilot testing is basically a trial run that is used by the researchers to examine their own design, their own methods, their own instruments, their own surveys prior to carrying out the actual research. So this dress rehearsal, if you will allow the researchers to make adjustments to their data collection methods, or even the design. Now, the data that are collected during pilot testing are typically not used as part of the larger research study, but should be documented in a way that the researchers can address in terms of establishing that pilot work. Other types of recordings here, the two types of recordings here include what's called continuous recording. And just as the term here suggests, we're recording some behavior in a continuous manner. And so we're making those observations of all the behavior of a target individual. The target individual would be a patient, a client, or a research participant during some specified period. That contrasts with what's called interval recording. Like continuous recording, it's a procedural method, and this is where the researcher makes observations uh, at discrete points in time that are different, with gaps of no collection or no observations in between those. And usually these include equal sized durations for the data collection period, as well as equal sized intervals in between the data collection methods. Can include smaller time periods as well. And the goal here is to identify when a target behavior has occurred. So in this photo here below, here we see a person whose forearm is exposed with recording electrodes that might be recording neural activity, and that's displayed on this computer monitor here. And so the person may be asked to perform some manual tasks while the electrical activity is recorded from their forearm. And this can be done in a continuous manner. So if the task is 5 minutes in duration, the instrumentation can measure this activity for the entire 5-minute period, or the recordings could be broken up into 20 second, 10-second, maybe even 5-second segments every minute. So for every minute, there might be a 5-second recording, 55 seconds of no recording, and repeated periodically over some specified period of time. So the last slide here in this video, we're going to take a look at a few other types of observations and variables that we'll focus on here in the next video. A contrived observation is an observation that in the research setting is intervened by the researcher. And what I mean by intervene is that the researcher is introducing a variable artificially, and this is part of the experimental design, and then observing the outcome of introducing that variable. And the variable that might be introduced includes a drug that might affect the symptoms of patients that have a particular condition, the intervention of a therapeutic approach to affecting some sort of pathology. Regardless, in this case, in this type of study, the researcher is applying some type of effect on the research participants and examining the behaviors. And then when we talk about quantitative research, descriptive statistics are the first statistics that are quantified from research observations. And the three examples of descriptive statistics include what are called the 3 M's of central tendency: the mean, which is another term for the average, the median, and the mode. The categorical variable is referring to variables that can be classified into distinct groupings. If it's a dichotomous variable, then we have 2 classifications of data or of participants that are studied as part of the research investigation. Continuous variable is one that, in theory, has an infinite number of different values between 2 different given points. And finally here, the frequency distribution is a graphical depiction of how the collected scores distribute across a range of values. And the frequency distribution is the key initial focus when taking a quantitative approach to examining observations. So this slide ends our first video here on observational research.